Good morning, everybody. Welcome to our virtual State of the State. I'm Mike Skelton from the Greater Manchester Chamber of Commerce. It's so great to see so many of our chamber friends logged on virtually this morning. And we're really pleased to be able to have this event today with Governor Sununu. I want to thank our sponsors before we get going today. Today's program is presented by Bellwether Community Credit Union, and our supporting sponsors are Harvard Pilgrim Healthcare and New England College. So we really appreciate the support of our sponsors. They make all the work that we do here at the Chamber possible. And before we dive into our conversation with the governor, I want to give Nathan Saller, the President and CEO of Bellwether Community Credit Union, a chance to say a few words. Nathan?
Thanks, Mike. On behalf of our 35,000 members and our entire team, Bellwether Community Credit Union is proud to sponsor today's State of the State event. As we all know, during times of crisis and uncertainty, communication and conversations become more important than ever. I'd like to thank the governor for his frequent communications with the citizens of New Hampshire over the last few months and for taking the time to engage with the Greater Manchester business community this morning. I'd also like to thank Mike Skelton and the Chamber staff for being a go-to resource for the business community over the challenges of the last few months, for their timely and pertinent communications, and for putting together quality programs like this morning's event. Finally, I'd like to thank all of you for attending virtually this morning. Certainly not the same as conversing over bacon and eggs, but nevertheless, I look forward to a very timely and engaging conversation. Thank you.
Great. Thanks, Nathan. I really appreciate your support. Bellwether's been such a great partner of our chamber and so many community partners. And again, want to also thank Harvard Pilgrim Healthcare and New England College for being our sponsors. So I'm going to have a few questions to kick us off, Governor. I want to remind everybody we have a very active chat room right now, which is great to see. I think everyone's got 3 months worth of chamber networking they're trying to catch up on. Encourage everyone. There's also a ask a question feature at the bottom of your screen, where if you'd like to log a question, myself and the chamber staff will be monitoring that, and we're going to try and get to as many of your questions as you can. So, Governor, first, welcome. Thanks for being here.
Thank you.
I know it's a very busy schedule these days. Just to start, I think a general question that we all kind of think about every day is just, where do you see us standing in your view right now with our efforts to combat COVID-19, and how do you feel about where we are right now and the next few weeks and months ahead?
Sure. So first, thanks for creating the opportunity, allowing me to come in and just spend a little time and answer questions. I definitely always appreciate the value of answering questions. It's sometimes why these press conferences go so long, because we let everyone ask anything they want for as long as they want. But it's good. It's good to get the feedback. And obviously, we try to be very transparent with what we're doing. I'm a big believer that in times of anxiety and crisis management, transparency is really that pillar of public trust. I talk about that a lot, so that folks can ask anything they want. We're out there constantly, so what we know and what we're doing is transmitted out to the general public and all the different aspects of what we're doing. And generally speaking, I think we're in very good shape right now. There's no doubt about that, especially compared to other states, given what we've had to do in just over 100 days, where we were 100 days ago to today, it's unbelievable. We've had to make some incredibly tough decisions I never thought any governor would make, and I hope no governor after me ever has to make. They've been very, very tough. And so I won't go on too long, because you guys get me, you know how winded I can get at my press conferences. But other than to say, in terms of the actual public health standpoint, obviously our numbers are low. We're very fortunate right now because we see what's happening in other parts of the country. Whether it's Florida or California or Washington or Arizona, about 25, 26 states, their numbers are just skyrocketing. And we're very fortunate we don't have that situation here. I do think we will see a surge, whether it's in a week or 2 weeks or 2 months or 5 months. There will be other surges here. It's just the natural state of a virus. There are things that I think we can and have to do as citizens, not just as the governor, but as citizens, to make sure that that is minimized. Wearing a mask works, right? Keeping our physical and social distancing, it's an absolute winner. And it's something that, again, we not just the governor, but you as business leaders, as folks in your businesses, your communities, your families, it's a message we all have to keep driving forward on. And unless we want to end up like Florida and Texas and some of these other states who I think not just opened up quickly. It's not just about that. They let the importance of that message of public safety wither a little bit. And they tried to, I think, move a little fast with, we're getting beyond COVID. We're not getting beyond COVID. We are in a crisis. We're going to remain in a crisis for quite some time. But it's up to us to all be part of that management system. Obviously, we had to make some very tough decisions on businesses. And again, a big thanks to a lot of the businesses and stakeholders who came forward with our Open Up task force. Our guidance documents are better than anybody else's in the country, frankly. They really are. They're more particular. They allowed stakeholders to really have an input on it. A lot of them are going to be in place for the long term, but they also provide that flexibility. Public health comes first, but the flexibility to get your businesses going in a stepwise manner. And a lot of folks have taken multiple steps now, and there's still some more steps to be taken. But it doesn't mean we're going to get to the point in the coming months necessarily where we're just like it was back in April, back in March. We're just not going to get there with certain things, right? And that's understood by, I think, most businesses, and especially given the accelerated rates of the virus you're seeing in other parts of the country. We have to take it stepwise. So I know right now about 25% of the people think we're going too slow, and 25% think I'm going too fast, and 50% are okay. And the more we get, to these harder decisions of opening up, how we open up, and the messaging around that, I know that we're not making everybody happy, and in some cases we're not making anybody happy. But I really do think we're taking the right steps. The last thing I'll throw out there is just on the economic side, we're going to have some tough economic times. The entire country will. I think we've set ourselves up here in New Hampshire again, as we have been for the past 2 or 3 years, to be ahead of the game, not just in the Northeast, but frankly on the entire East Coast economically, because we have a lot of liquidity in the market. When we get CARES Act funds, we move it out very, very quickly, and we move it to businesses. A state like Vermont has barely spent any of their CARES Act money. I've already spent nearly $400 million just on businesses, a couple $100 million in hospitals and things of that nature. When you add PPP money that has come into the state, about $2.5 billion, about $500 million that I've put out in terms of the Main Street Relief Fund, the money to hospitals. Federal government's put a couple $100 million. I think hospitals have gotten about $300 million so far, and more to come, which is really, really powerful. About $860 million has gone out just in unemployment. It's a staggering number. A lot of it is federal, but remember, that's cash going into the economy. That's cash going into people's pockets to pay bills and taxes and spend their money. And so the good news here is that I think a lot of the federal government money that's been spent, and it's been an astronomical sum, is really designed to prop up the economy, get people spending it, and getting it churning, not just sitting in bank accounts and saving accounts of banks or something like that. The banks have a lot of liquidity right now. Their programs are really designed to make sure that people get dollars, spend the dollars, and don't have to go on big government programs. So all told, you're looking at probably close to $5 billion will be injected into our economy in the next, between two months ago to about a month from now. Given that we have a GDP of about 70 billion, that's a lot of money. That is a lot of money coming into New Hampshire to help prop up these tough times. And I think that's going to give us, again, a lot of that liquidity and keep a lot of businesses floating. A lot of businesses will go under. There's no doubt about it. We've tried to save as many as we could. I put out, as you guys know, 5,500 checks in the Main Street Relief Fund, totaling about $340 million was sent out this week. We're doing another fund. We estimate about another 10,000 self-employed individuals weren't able to apply to that fund. We're going to open that up. We're making that announcement today. We're going to open a round of funding similar to the Main Street Relief Fund. It will actually work a little faster, frankly. And so the checks might not be as big. The average Main Street Relief Fund check was about $60,000. Some folks got up to $350,000 for their business. So we're very happy to know that we were able to save a lot of businesses, and now we're able to put a lot into the self-employment. And maybe we come back with another version of the Main Street Relief Fund. Very few businesses are putting their CARES Act money. Very few states are putting their CARES Act money directly into businesses like we are. But I think we share a vision that when the economy does well, when businesses do well, the state does well. It's really the one of those fundamental pillars to ensure that people have a better quality of life. So there's a lot going on. I think we've made some very tough, but frankly, very good decisions. Someone asked me, what do you regret? I don't know. I think when the dust settles, maybe there'll be some regrets, but I can honestly tell you, I think we've made the right decisions at the right times, given the incredibly tough situation that we're in. Governors are all working together fairly well. Every governor has a different situation. Charlie is dealing with something very different in Massachusetts, and Phil in Vermont, and Janet in Maine, all very different situations. And I've talked to DeSantis in Florida, and Greg and Greg Abbott in Texas, and those states to see, what's going on, why are those numbers increasing, and we're trying to learn from that data. It means that we might have to make actual tougher decisions. We might have to pull back on certain things if and when we can really pinpoint what's happening in those states. We're going to have to make some decisions to make sure it doesn't happen here. Doesn't mean we clamp down on the economy like we did. We're still going to keep the vast majority of everything open and moving, but we want to be smart about how we do it. And whether it's mass or physical distancing or limiting hours on certain things to make sure we don't fall down that path, that's going to give us a lot of confidence moving forward. The last thing I'll throw out there is the big unknown that I see coming forward is school. University system will be opening in New Hampshire in September, as will the K through 12 schools. But they're going to have some new guidance, and it all makes us very, very nervous, frankly. You're putting, especially the university system, those numbers you're seeing in other states are primarily between 20 and 30-year-olds. They're going out, they're socializing late at night in indoor settings, and they're passing the virus very, very quickly. They don't get affected as much, but their parents or grandparents will. And their communities do, ultimately, if they're not isolated quickly enough and they don't identify their symptoms quickly enough. So that's a very similar to a college setting, right? You're going to have fraternities or dorm parties or whatever it is, and large gatherings of individuals in tight areas. That's just the way college life works. You can try to put all the guidance and limitations on that you want, but it's hard to manage. A guidance is only as good as what can be enforced. It's why I believe very strongly in wearing a mask, but I don't think we're at the point yet where we're going to say, well, you have to wear a mask, because it's so hard to enforce that. And you're asking local police and the PPE police, as I call it, to come out and start giving people tickets to wearing masks. We're not there, and hopefully we don't have to go there. But similar to the college and university system, or even K to 12, we want to create guidance documents that are manageable. And it's not going to be perfect for everyone. There are going to be sacrifices that have to be made. But we want to create something that, again, puts public health first, but allows these things to flex open in some way. So we're in good shape. We're putting a lot of money back into the economy, a lot of money into businesses. It's not going to save everybody, but I got to tell you, compared to most states, go talk, I talk to people in restaurants or hotels or whatever it is, and I say, go talk to your counterparts in Massachusetts. We're doing pretty darn well compared to what they have to deal with down there and throughout most of the rest of New England. So, we're just going to keep trying to make the best decisions we can. Having your input is very, very important in all aspects, not just opening up, but what you're seeing out there, driving workforce, what's happening with unemployment. It's kind of disincentivizing people from getting back to the workforce. We all know that. So how that plays out towards the end of July will be very interesting, but we're going to be on the right path. I really believe that.
Thanks, Governor. There's a lot of issues you teed up there that I think we want to come back to, and we have some audience questions coming up as well. I just wanted to ask one question, kind of looking backwards a little bit, because we're actually 3 months to the day, I believe, to when we had this event scheduled in person at the New Hampshire Institute of Politics. And I think at the time we probably canceled it a week or so prior to that because of everything that was happening at the time. And I think for all of us, this came very suddenly, where the situation we had been hearing about in the news, and then it was on our doorstep, and we were all reacting very quickly, and a lot of sudden changes to society. I'm curious, when did you first hear about COVID-19, coronavirus as a threat, as a potential issue? Was Dr. Chan and the state public health team, looking at this? Did they, what was the kind of, looking back, our first kind of warning signs and ability to prepare for this guy? I think because that was one of the, the hardest parts of all of this for everyone, for every business, for every individual, is the suddenness in which it went from an abstract threat to a real threat that changed our everyday lives.
Sure. So I think as early as back in December, we were talking about it. We had seen what was going on in China. Dr. Chan and his team are very good about staying ahead of the game in terms of what's happening out there. In all, not just COVID, but in anything that could affect public health. And so we were talking about it just because of what we were all seeing on the news. We were no different than what we're seeing on the news, looking into it, trying to understand, was it a form of the flu? Was it a flu-like? Was it more, what was the real transmissivity value? It was hard to get the data out of China. And it probably wasn't until maybe late January I was talking to some folks in Washington about the realities of it and whether it could really be here. I want to say I think the first time we knew it was going to be a significant threat or a potential real significant threat was when we saw what was happening in the state of Washington. They got some of their first cases, and then an outbreak in a long-term care facility went like wildfire in about 20 days. We didn't even have a case here, and you had a massive outbreak there. And that's what was starting giving us a lot of the data on the if it gets here, this is what's going to be a problem. And very quickly, within a matter of hours, we realized it isn't an if, it was a when. And when it got here, it was going to be an issue. So we started gearing up and really start talking about it earnestly, probably early February, knowing that it really could be here. I'm doing this off the top of my head in a rough timeline. And then obviously we had our first case, I believe, on March 2nd, technically. And it was more of just kind of a wait. When's it going to come? When's it going to come? We'd seen other states around us have other hits of it. So we knew it was a matter of time. And what we didn't really understand is the rural nature of our state. Was that going to provide a lot of that physical distancing and allow the virus to transmit? We really didn't know if it was just going to be isolated to institutions in large cities where the transmissivity value and the migration is so rapid, or whether as a rural state we would be not immune, but it wouldn't really affect us here. But obviously, it within a matter of weeks through February, we knew that if and when it got here, would be something we'd have to deal with. And that's when we started really trying to gear up on everything from PPE, stockpiling, testing capability. That was our big issue early on, just understanding the test didn't exist. Remember, the federal government basically had to say, okay, we finally have a test for you. Here it is. And that's what we were relying on for so long. They were the ones that were providing all the immunoassays and the swabs and things of that nature. And then it really escalated from there. After that first press conference in March 2nd with the congressional delegation, it coincided coincidentally with our very first case. We found out that morning. And it's been hell and back since then. I don't know a better way to explain it.
We have a couple questions related to travel restrictions, and that you alluded to the fact that some other states right now, unfortunately, are seeing huge jumps in their cases, and Florida, Texas, in the South, Midwest, and we have a couple of questions from folks asking if will we consider any sort of travel restrictions, mandatory travel restrictions, or quarantining for people traveling from those states into New Hampshire. Particularly in one case, we just had a member ask about they have employees traveling back from Orlando, and their other employees may be uncomfortable with them coming into the office, and so how do we navigate that line between what's mandatory, between what you can ask someone to do?
We're asking everyone that comes from out of state to quarantine for 14 days. And we're not picking and choosing Florida versus North Dakota, because Florida has a crisis today. North Dakota could have a crisis tomorrow. We came to the conclusion that we don't want to pick and choose states, because people would have to be re-looking up what state has a 14-day quarantine and what doesn't. So we're saying if you're coming from out of state, if you're traveling from out of state, we're asking for a 14-day quarantine. And or a test, go and get tested and show that you're negative. And it's so easy to get a test now. Actually, one of the problems we're having is not enough people are asking for tests. We're telling people, why not have your entire staff tested today? There's no reason why not. It's painless. It's easy. It costs nothing. I mean, I went and got my Rite Aid test. At my test at Rite Aid, they never even took my health insurance card. I was actually shocked by that. And it literally took 2 minutes at the drive-thru, 2 minutes. So why not just get your whole staff and office tested? Or when folks fly back, get them tested when they fly back, maybe let them quarantine for a few more days to see if they're symptomatic, and get another test. And if you do that, you can kind of get back into the flow of things in the workforce. But there's no doubt that it's not just where you come from, but just being on that airplane and being in the airports. There's a lot of transmissivity that happens on airplanes. That's what scares us just as much as where you might have been. So that's why we're keeping that in place. It's not mandatory, but we're asking folks to quarantine. It's not mandatory, again, because I can't go knock on, and I'm not going to knock on everyone's door. Are you staying in your house? Well, I think if we all have an elevated message in a sense of that personal responsibility, and we take it seriously, you don't, and as a business, you don't want someone to come into your office if they haven't quarantined for 14 days or proven that they're negative. You don't want that. It'll wipe out your entire business very quickly. You saw that happen in South Dakota, especially with some of these manufacturers. It went right through like wildfire, some of those businesses, and shut them down. Meat producers, especially, for whatever reason, all across the country, those have been really devastated. So, we asked people to quarantine for 14 days, and that's likely going to stay in place for quite some time.
A question about hospitals, and you mentioned how they've received a number of support through some of the funding that's come in. Obviously, here in Manchester, we have two very large hospital systems that have borne the brunt of a lot of the COVID treatment, given the population concentration in the southern part of the state. Have they received, has there been a way to ensure that those hospitals that are treating the most patients are receiving the funding that is commensurate with the services they're providing, so that, those that are, bearing the largest burden, if you will, of that, are able to recover, because, of course, both Elliott, CMC, Dartmouth-Hitchcock have big presences in our community, in our region, and they're a big part of our economy as well, and major employers.
Yeah. So I did not know you were going to ask this question, but I do have, do you see this? I don't know. Can you guys see that chart okay? So what this says is this is the amount of money that hospitals all across the state have received from the federal government. And they've done 3 or 4 different rounds of funding. I'm peeking behind my paper here. This is Dartmouth-Hitchcock. This is everybody else. So we've had hundreds of millions of dollars, about $250 million come in from the federal government. We'll probably have another couple $100 million come in, which is great. The federal government's been helping out. The way they did their initial formulas was the first one was okay. The second one focused on rural hospitals. Well, Dartmouth is considered a rural hospital, even though they're so big and massive. So they got this very disproportionate share. But to your point, Manchester and Nashua have faced the brunt of the issue around COVID, and the formula wasn't working. So I talked to the Secretary Azar. I've made a strong push, writing letters and talking to him directly about changing the formula so that this bizarre disparity, this isn't bad. This is weird. This is just off, right? And by the way, they have like $300 million in their own endowment. Don't even get me started on that. The hospitals are doing great work, but we need a formula that works for New Hampshire. And so we're trying to get them to change the formula for the next subsequent rounds of funding and get Catholic Medical, Elliott, Southern, St. Joe's, some of those ones that are really hitting the brunt, specifically in Hillsborough County, more money because they're the ones that have really had to make the biggest sacrifices. So I give the HHS credit for for doing it in multiple rounds and changing, always working to try to tweak the formula. We just want a version that works for us. And then on top of that, I have $100 million sitting in a fund. About $50 million has already gone out for hospitals and healthcare centers. Another $50 million will go out on additional requests, as well as for long-term care centers. And we have more money available if we have to do that. But the federal government is going to, at the end of the day, end up putting probably somewhere between $300 and $400 million into the hospitals in New Hampshire. We just want it to be equitable.
I have another question that I think we've heard a lot about in recent weeks and months, is that COVID-19 is not necessarily impacting everyone equally, and that different populations, obviously by age, but also by race and ethnicity, might be more susceptible to the impacts of COVID-19. And what is the state doing, and what can we do as members to ensure that all residents, regardless of race, ethnicity, color, are able to recover from this equally? And is that something that you've been monitoring and looking at and are concerned about here in New Hampshire?
Absolutely. So it's really an issue across the country as well. You see the disproportionate effect of COVID with minorities, people of color. And there's a couple different reasons why that might be. I put a task force together very early on to find those early determinants of health specific to COVID and other viral issues. It's not just COVID. It's typically with other viral issues we're already identifying that this is a pattern. And again, it's not just New Hampshire, it's across the country, but we still have a responsibility to make sure that we're closing those gaps. And it's really an opportunity gap of healthcare is what I believe. And there's not a final report just yet from the task force I put together, but it's really an opportunity gap of healthcare and those social determinants of health that are driving a lot of that disproportionality around COVID-19. So we want to make sure that folks in those communities, wherever they may be, have equal access to healthcare. We know that COVID affects not just the elderly, but folks with underlying health conditions at a disproportionate rate. And what we're finding is folks within those demographics have a disproportionate share of underlying health conditions as well. So it's compounding upon itself when you get something that's as rapidly spreading as COVID. And we just want to make sure we're there for it, which is why we end up putting a lot of our resources in the Manchesters and the Nashuas and a lot of those areas that just have higher populations of those minorities or people of color or whatever it might be. But we're looking at this from a very data-driven standpoint. We're saying, okay, where are the numbers? Where's the data? Where's the gap in the system? We don't just throw money at it, but what services are going to be generated from the dollars that we can invest? And we have some money to invest because that is a COVID-driven gap. So I could spend CARES Act money on that, but we got to make sure that it's really being focused. It's just, a lot of you have heard me say this before. It's very easy for politicians to say, I'm going to approve some funding and I'll approve of this new policy, and then they move on to the next thing. But it's really about the outcomes that you're generating from those processes and the operationalizing of that opportunity for the individuals. And that's the opportunity we have here in New Hampshire. We treat people as individuals, community to community, neighborhood to neighborhood, and healthcare system to healthcare system to, again, close those gaps and not just write a report, check a box, and move on to the next thing.
Thanks, Governor. We have a couple more questions to get to, and I just want to remind everybody to keep logging in their questions. We're going to get to as many of these as you can. I want to ask a question about testing again, Governor. You mentioned that we're doing really well on testing capacity, and this was a question about if someone chooses a test that is not covered by a provider, a different type of test, is there any thought about adding a way to help defray those costs or help with those costs? And maybe you could explain for those that aren't aware, are there testing options that that the state is offering and supporting that are free, and what would be the tests that someone could choose that may not be covered by that? And then I would just add on to that, looking ahead to that future potential surge that we hope doesn't come, but we have to prepare for. At this point, do you think our testing capacity has reached where it needs to be, that we are prepared for whatever that might look like?
Sure. So if you're talking about COVID tests, there's no financial barrier to a COVID test. So either your healthcare provider will pick it up or the state picks it up. It's that simple. There's no barrier there. Same with the antibody test. Either your healthcare provider will pick it up or the state picks it up or the federal government picks it up, one way or the other. But if you want an antibody test, Clear Choice MD has been, which has a lot of different facilities across the state, is doing a lot of the antibody tests. That's a blood draw. COVID test is a couple different types, but again, you can get them pretty much anywhere across the state, whether it's Convenient MD or Rite Aid. Most hospitals will actually do them now. They're going to be setting up a lot of their testing centers for outdoor use. And so we're really transitioning from early on, it was the state doing all the testing, and now the commercial side and the public health sector is doing the testing, which is exactly the way it should be. But there should be no financial barriers to that. And we just really want to encourage everyone to go get a test. Now, is our capacity where it needs to be? The answer is yes, because anyone who wants a test can get a test. And that's I don't know what more capacity you could have than that. When you start looking at some of the demands on the individual system, specifically the university system or school systems, we'll see where that demand really goes. We know we're going to ask pretty much all the students that come back to school to get a test. There'll be some regular testing done at some of the universities. They'll be partnering with hospitals and healthcare providers to ensure that testing goes off without a hitch. And so I think in the fall, nationally, we're going to have a bit of a you'll still be able to get the test. My sense is maybe instead of a 2-day turnaround time, maybe it'll be a 4 or 5 day lag time. Some of these larger national testing organizations are just stockpiling testing materials. So the test will be there. More devices are being built all the time. I guess we'll just wait to see how bad the surge demand gets. But if you want a test, you can get a test, and that door is going to be open for everyone for forever.
A good follow-up to that is just around, again, a question that came in on antibody testing, and there's been some discussion and media reports around at different times the effectiveness and accuracy of that test. And so how do you see that issue? How has Dr. Chan and the public health experts see that issue, in that, is there really benefit for people to go out and get that antibody test, and does that add to our information to understand, the level of immunity in our state? Yeah.
So there's 4 or 5 antibody tests approved by the FDA right now. None of them are perfect by any means. There are flaws with all of them. Usually A negative means I got to get it right. A positive means you're definitely positive. A negative could have a 10 to 20% error rate sometimes. So we track the data. It's useful data, but it's not absolute data. I think we're still a ways away from saying the antibody test is, rock solid. And then what do you do with it? Right. So let's say, right now, to be honest, it's somewhat of a curiosity factor. Well, I know I can put myself in a situation, and I know I'm not very likely at all to get COVID again, because I may have had it without even knowing that I had it. But then what do we do with that? I mean, do we ask everyone in a university system to get the antibody test, and if you've had the antibodies, you can go to the football game? Like, no, probably not. I mean, we're not going to start asking people for their antibody papers. So right now, from the state's perspective, I don't think we're creating any guidance or opportunities based on the antibody test, but it does help us determine, are we getting closer to what they call herd immunity? Are we getting closer to kind of naturally providing more viral walls, if you will, and that will help reduce what we call the R naught value and that's really, if the R naught value is greater than 1, for every person that has it, slightly, more than one person will get it. But if it's less than 1, for every person that has it, less than one person will get it mathematically. And that's a good thing. You want to be under 1. So that the antibodies that are out there would really determine that value and give us a better sense of where our models may go in the future. We look at models, by the way. We don't count on them by any means. Data trumps models. Data is what is most important. Models are very inaccurate. They give you kind of we think that's where it's going to go. But at the end of the day, the most important tools we have in redirecting those models, like I said, is our own personal responsibility that we're taking at work, in the workplace, at school, in our communities, and wearing masks and maintaining physical distancing.
Another question on testing. Does the state, in terms of there being no fee barrier to taking a test, does that include someone who travels to this state from somewhere else? If they've come up here to visit family or on vacation or something like that, can they still access those tests with no fee barrier?
They can. They could go right online, sign up at Rite Aid, pick your time and go. That's it. I mean, or Convenient MD or any of the other locations. Yep, it's all taken care of.
There's been I think for businesses and employers, the universal guidelines have been, obviously one of the most critical documents for us to digest and understand, because it applies to everyone. It's kind of the baseline that we're all trying to incorporate into our operations. I know there's been some discussion. We had a question come in about this as well, of continuing to tinker and refine and change those to find ways to make them more applicable or ways that we can implement them, particularly around the screening tests that come in. Can you speak to any of the issues that you and the task force continue to look at, of how you might be changing or continuing to refine those guidelines?
So we're always looking to refine them, but I'll tell you this, we could refine them every other day, but frankly, that would cause mass confusion and chaos in the system, because now we're asking people to go pull down the new universal guidelines and train your entire staff to them every single day. And I think working with public health, I think I was able to convince them, as someone who used to run businesses, it wasn't very practical to do that. So we've had an initial set of universal guidelines. We made a major change to them a couple of weeks ago when we started flexing things open. We're not making any. We'll take them in kind of big chunks in terms of making change, just because of that. We don't want people to get so frustrated having to constantly spend all their time on these things and understand them on a day in, day out basis, that they end up not using them, right? At some point you say, this is getting too confusing, I can't keep up, we'll just do our best. And they end up throwing them out. So we want to make it workable for businesses, both large and small, and make it practical. So what we're trying to do is take it in bigger chunks. And ultimately, having all these different guidances that we have set up, excuse me, I'm talking with I'm a big hands guy, for restaurants, for lodging, for movie theaters, for bowling alleys, whatever it is. Ultimately, we want to bring a lot of those under one umbrella. Right? We tried to be very specific because we felt like, and I think it was the right thing to do, to spend the time to do it, to make sure we were really maintaining public health, as opposed to just saying, wash your hands and don't go near each other. That doesn't really give the right message, the right time, and it doesn't work for everybody. So we tried to be very specific with the guidance. Ultimately, we'll get some of those guidance documents under more of a unified umbrella. Knowing that the numbers are now going up in other parts of the country probably gives us a little more pause, frankly, in doing that. We would rather keep the specific, more detailed guidance to allow that flexibility. knowing that they were really tailored for the actions that business undertakes, whether it's retail or an arcade or a movie theater. Try to be very specific about it. And in many ways, being more specific allows those businesses to be more flexible because they were designed by those businesses. We're not asking a movie theater to work by the guidance for Canada Lake Park. So ultimately, we want to get there. We want to make it a little more seamless, but at the same time, we also know that we can't take a different step every single day. Even though we probably could, we probably learn something new every day and could tweak this and tweak that and tinker with this. We're trying not to tinker to avoid confusion. We're trying to take larger steps, and then obviously just be flexible. If things don't work for a certain business or a certain industry, a lot of them have come back. The barbershops and the salons saying we got to use blow dryers, and so we made that change within a week, and we got them to use their blow dryers. And so we're always willing to be flexible as we can, knowing that I don't mean to be repetitive, the most powerful tools are the masking and the physical distancing.
One question that is somewhat related to what we've been talking about with testing is contact tracing, and wonder if you could speak to where you see the state's capacity and systems for that activity, and is that a place you'd like it to be? Are you trying to continue to ramp that up looking ahead into the fall?
We are very good at contact tracing, and frankly, we've been one of the best. I'm not just bragging on our system, but a lot of states early, about 2 or 3, 4 weeks into this whole thing, as the numbers started to really grow, they got rid of contact tracing. We didn't. And I think it's one of the reasons why we kept our numbers so strong and so low, I should say, because we were always right on top of people that had a positive. We did the contact tracing. We found out where they were, who they had interacted with. We were able to get them quarantined. People took that seriously, and that was a powerful tool flattening the curve. We have over 100 contact tracers. We're going to be outsourcing a lot of that in the future to just these larger groups to get. Our contact tracers are the National Guard. They're people that have been redeployed out of other parts of the state, folks within public health. And right now, we're constantly retraining folks. But we have basically an army over at a facility in Concord doing a lot of this work. It's gotten a little easier as our numbers went down, but we have to be prepared to move up. And there are ways to do that. So we're going to stay right on top of it. It's a very powerful tool. One of the hardest things we're finding right now is a lot of people don't pick up the phone. A lot of people are not calling us back when we say, hey, you were here with this individual that has COVID, would you please give us a call back? A lot of people aren't doing it, partly because of the protests. I think we're doing a lot of we didn't have a lot of COVID outbreak because of the protests, but we're really trying to manage the contact tracing through that. Please pick up the phone. Just give us some of the information and the data. We're not big brothering you at all. We're really just trying to make sure that you and those that you've been in contact with know that the risks you might have and to keep a lookout for the warning signs. But our system is very good, and we're going to stay right on top of it.
So one question that came in that is certainly important to us at the Chamber and many other organizations like us is this event has obviously gone virtual, and lots of other events have done the same. And we're all doing our best to kind of pivot and take advantage of that opportunity. And it's gone pretty well, as we can see with a great attendance this morning. But I'm wondering how you see in-person events and gatherings. Obviously, those are some of the riskiest things that have been identified as spreading events and things I'm assuming we're going to have to be the most cautious with in terms of bringing back over the next several months.
Without a doubt. So the in-person events, they'll start flexing open. They already have a little bit, but even folks that say, hey, I really want to do my in-person event. I think I'm scheduled to do one. It's like late July. And to be honest, I'll probably come into the event, I'll speak, and I will leave. I won't, it's weird because me, I like to, hang around and talk to people and shake hands and all that and just say hi and hear what's happening. But it's going to be a tough thing. So I think what a lot of groups are also finding is individuals are saying, we don't want to attend in person. I don't feel comfortable with that. Mm-hmm. They live with a loved one. They're older themselves, whatever it might be. I think most people know that there are real risks out there. And so even the events that do happen would likely have, very, very minimal attendance. So I think people are going to be cautious about it. We'll see how it goes. We'll step into it, so to say. We're allowing weddings for an example, and that's a little different than a chamber meeting or something like that. We're allowing weddings, but at 50% capacity, just so people have more physical distancing about them. We're not banning people from dancing together or anything like that, but we sure as heck aren't encouraging it. And so we're asking people to make those sacrifices, whether it's in your business meetings, your trade association meetings, your personal stuff like a wedding, to go the extra mile, understand that these are very challenging times and we all have that responsibility. And I think if we maintain that, a lot of these things can get going over the summer. And we'll find a way to do them in combination. For example, a chamber event that's going to happen in person, I think should still have some type of WebEx or whatever the system might be component to it. And one thing I found is, and you might find this as well, when we do our executive council meetings, for example, we just do them telephonically. They work very, very well. They take a little extra time, but not really, nothing we can't manage. We have hundreds of people that participate. Right? It's a lot easier for people to participate in some of this stuff because they can do it from their home. They don't have to get in their car and go that way and go to the location. So having this kind of new model of doing it both virtually and in person, I think is something that should probably stay with us for a while and likely will.
I think you're right on that front. We've seen a lot of positive engagement with virtual events. So a major issue of concern, I know for you and for many public officials, is the impact of the pandemic on state and local governments. And had a question come in about whether you could issue an order that would allow municipalities the flexibility to modify their budgets that have impacted by lower revenues. And then just generally how you see us navigating this issue of, the dramatic impact that the pandemic will have on state and local governments. And there's kind of a lag to that in that, we're going to be with that. That's going to be a lagging impact over the next several months and perhaps year.
Yeah. So I believe the Attorney General, he's been working with his team for 2 or 3 weeks now, trying to figure the right path, the right legal path for towns, specifically as it pertains to their budget process. We know that they're going to need a lot of flexibility and we're going to provide it. I think I'm not a lawyer. Thank God. No offense to the lawyers, but I wouldn't be a good lawyer. I'm more of a manager. But really providing that legal pathway that works within the confines of the towns, but also allows meets the certain guidelines for the state so they can manage their budget process. In terms of towns, in terms of how they do zoning meetings or board meetings or just town selectmen meetings, voting, things of that nature, it's all going to look a little different. But again, it can all take place. I know some towns that are doing their meetings in public. They're just keeping they're going to their town hall. They're keeping a lot of social distancing. They have the luxury of having a lot of room so they can still invite the public and manage the seating and have people participate one way or the other. Some towns still have certain physical constraints that make it difficult for the public to interact. And again, just to getting back to those meetings are very important, whether it's getting a driveway permit or getting a building permit or whatever it might be, doing basic town functions. Those meetings have to happen, but should likely continue to happen in a hybrid manner with both virtual and in person. And then finally, just coming into the clerk to register your car, coming into the town clerk to do whatever you have to do, get a dog license or do whatever you have to do at the town. Hopefully that will get back to normal. But again, this is all, well, I think we had some pretty good online systems early on. I think this will just amplify people's ability to do online. And I think it has helped the state to understand that a lot of things can be done online. Do we really need a wet signature on everything? Well, no, we have good technology that can help do verification on signatures or things of that nature. So, this is kind of a real accelerant, if you will, into I think where we probably wanted to be 5 or 10 years from now in terms of using technology to do day-to-day interactions with government. I think we're finding that we don't need as many staff or we don't need as many old-fashioned protocols. We can use technology in the right way, but still have the auditing and enhancement of ensuring what we're doing is right, legitimate, and we're removing or reducing the waste and the fraud and things like that. That I think a lot of people are hesitant about using technology because they're afraid it will be abused somehow. They still want to look someone in the eye, person to person, and watch them sign a document. In a lot of instances, you still need that, to be sure. But in a lot of instances, we're realizing, maybe that pathway was antiquated. Maybe there's just a better way to do it. DMV, great example. Moving forward, we're opening up our DMVs more aggressively now, but there's still a lot of things that we had moved online, made a lot of waivers for. And the discussion is, well, why do we have to go back? Why can't we just keep it like this? Why can't we just keep the flexibility that we were forced to create? Because it's flexibility for the citizens, and that's a win.
A quick follow-up to that is, it sounds like, and I know I've observed this and had some discussions with folks in the business community about this, that as businesses, we've learned a lot of things about how we can operate differently that were out of necessity, but are now just good ideas that we're going to stick around with. So it sounds like there's a similar dynamic happening in government. And I wonder if some of the things that your various emergency orders have allowed state and local governments to do, should we start thinking about, what changes do we need to make those permanent? Is that something that you're starting to think about that flexibility so that we can keep some of these good ideas?
Absolutely. One area I'll talk about a little bit is licensing and permitting. We've created a lot of flexibility and waivers in terms of doing your licensing and permitting online, taking your classes virtually, whatever it might be. To be honest, there's probably a lot of boards that that don't like it now. They know they had to do it out of necessity, but quickly want to go back to the way it was. And there's going to be a bit of a battle there, I think, to try to keep some of the flexibilities that we've created. Some people just like to do it the old-fashioned way. They don't like the ease, if you will. They want to have a little more control on things. I tend to believe a little more in the personal responsibility of the individual and just allow them that flexibility, because you can use technology not just to provide the service or the permitting or whatever it might be, but also the auditing and the accounting and kind of that back check that you want to have to make sure that whatever is being done is legitimate. People are doing their online courses or whatever it is. They're not just blowing through it. There's a lot of technology there, not just to allow it to happen, but allow it to happen the right way. And I think that's what we need to train some of these other boards and these antiquated systems to. Government doesn't like to be flexible. I do, but government traditionally doesn't. It's one of the things that we're constantly, I don't want to say fighting here, but working to improve, continual improvement. This has been a shot in the arm for us, and I think in some ways it's been a real opportunity to open our eyes to what is really possible. And if it's working, it's working. Why go back to a system, an old-fashioned system, if this new, more streamlined system is already working really, really well?
Another question that I think is incredibly important is we obviously take our responsibility in this state on voting and participating in our elections extremely seriously. And looking ahead to November and even September with the primaries, what precautions do you want to see the state and local government taking to ensure that we can vote safely this fall, whether it's in person or using absentee and those different options?
Sure. So, New Hampshire, as I think everyone on the call hopefully knows, we do it really, really well when it comes to voting. We always have had the highest, one of the highest, if not the highest voter turnout. We provide a lot of flexibility with our absentee ballots. We're even going to provide a little more this year. You can check a box that says for COVID-19. So we don't need to change our system because of COVID drastically. I think we're literally adding a line on the absentee ballot process, making it a little easier for folks to not have to show up in person if they don't want to. We're going to, for those who do show up to vote, we'll make sure that there's physical distancing there. We'll make sure that there's enough time. We've told towns to really get a sense of, who can be a moderator, how to bring more people into the system. We had one or two towns say that they wanted to, they said, we're not going to have enough people working at our polls. It looks like they're older. They don't want to participate. They're a little nervous, which is very understandable. So we're going to contract down to one polling location. And I said, no, that's the worst thing you could do. You're going to create more lines and more difficulty there. You're creating a problem that we don't have to have. If anything, we need to do more polling locations, right? So the lines are shorter and that the system works better. And towns have enough time. They have plenty of time starting now to September and November to make sure that they have the staff or the moderators or what they need. There's millions of dollars that have come into the state for additional staff or for additional absentee ballots or whatever it is. Secretary Gardner down the hall here has put together a task force, and I think they've done a great job looking at some very practical recommendations. Nothing major, some slight tweaks to the system for November, but we're very fortunate in that we have a system that already works really, really well. Some towns have already experimented successfully with drive-up voting. So you drive up just like you have, you show your ID just like you do, you prove that it's you to someone on the checklist, and you simply fill out your ballot in your car. And then as you go out, you drop it in the box. And so it's the exact same process, but you're just doing it out of your car, and it's been validated and confirmed, tried and true. And so towns that can do that may choose to do that. So we're trying to provide a lot of flexibility, but our system is pretty rock solid to start with. And now it's just about making sure that we're fortunate that our election is not tomorrow, right? Some of these earlier states you saw, their elections were in June or even May, and it didn't go well. It didn't go well at all. They probably didn't have a great system to start with, and then they just didn't know how to manage through it. We have a good system. We have plenty of time to prepare, and I think it's going to go off very, very well in September and November. Maybe it might take a little more time to count those absentee ballots, an extra hour or two at night. We're going to allow them to do certain things, just like, we talked about opening the outer envelope, before 8 a.m. That's fine. You're not opening the ballot at all, nothing like that. Just little time savers like that are common sense, don't create any abuse or fraud into the system, nothing like that. And everything that the Attorney General and Secretary Gardner agree. I mean, these are the two best people in the country, frankly, that know how to run these elections, that agree are safe and smart. And so little tweaks to the system for this year, but we're in a very good position.
So we have time for just a couple more questions, Governor. One thing I wanted to ask is, one thing that was disrupted quite significantly is obviously legislative session. And the legislature has been trying to get back to some form of business and has some certain constraints that they have to operate under due to rules. And we're seeing kind of these omnibus pieces of legislation potentially come forward, where a whole lot of pieces of legislation that organizations like ours and many others were following with interest because of their impact. And just wondering, how are you going to approach, that piece of the puzzle here? And I know nothing is on your desk yet, and nothing is set in stone, but just wondering your take on how legislative session is going to wrap up and how you'll approach it given your role.
Yeah. So, just to take a half a step back for folks watching, basically the omnibus bill says, look, here's a bill and here's a bill, and we're going to put 40 of them together and hope for the best. It's a really not a good way to do it at all, frankly. But I understand we have to do that. We've tried to encourage them to put germane items with germane items. But at the end of the day, in some cases, you could have 40 bills all thrown together, some of which I would normally sign and some which I would normally veto. So it's going to make it very, very challenging to move forward with a lot of this stuff. There could be good omnibus bills that I don't sign and bad omnibus bills that I do sign, because I just have to kind of look and what is going to be in those bills. We have a sense of it right now, but they're supposedly even going to put some new legislation up next week on Monday, even though they only have a day to review it. The House would just concur or not concur. So a lot of this stuff is not getting public hearings. It's not getting public notice. That gives me a lot of pause. If it's something that we could probably wait on and have the validity and the importance of a public discussion, then we should wait. We should just wait till next session. There's nothing wrong with that. And so I'm not saying I'm gonna err on the side of a veto, but I'm probably gonna err on the side of a veto, on a lot of this stuff, just because let the public have a say, let it come to light. We take a lot of pride in understanding the importance of letting stakeholders and the public have a say on this stuff and not having things happen, for lack of a better term, behind closed doors. They're trying to rush a lot of stuff, and I understand why. But at the end of the day, I think there's for some of the stuff, if it's an emergency and we have to and we should do it, of course I'm going to sign it. But if we can wait, why not wait? If it can wait just 6 more months and we get the public input on it and we get to review this stuff a little deeper. Some of this stuff is not getting any public hearing really at all, especially on the House side. They're getting nothing. The House's only ability is to concur or not concur in a singular vote with no discussion. That's unbelievable. That has never happened before in this state. So when in doubt, I think we just want to slow the process down and take our time. But there'll be some good bills that I sign. I have no doubt about that. But there'll be some tough ones there that unfortunately I'm probably going to have to veto. Some is just bad legislation. Of course, I have no problem vetoing that. I've had a lot of bad legislation in my desk that we vetoed, whether it's the income tax or all the fees that they wanted to put, the new regulatory barriers that they were trying to put up. I vetoed, 57 bills because those bills had never touched another governor's desk in the history of this state, things that we had never seen before. Well, of course I'm going to veto it. It was really wacky out there legislation. So if they try to come back, and that's the other thing, I think they're so short on time, but they're just putting in a lot of bills that I've already vetoed and that have already been sustained, and they're spending their time doing it again. That's a waste of time. It's a waste of taxpayer time and dollars. They know I'm going to veto it again. I wish they would just focus on real priorities of the state. Unfortunately, that's just not happening. Whether it's political or what, I don't want to be too judgmental on that, but it's political. And so we're just going to have to make a lot of the decisions and say no to the bad stuff. But I think there'll be some good bills, omnibus bills, we can get done.
So we have to start to wrap up, Governor. I wonder, a good closing question, I think, for all of us. Again, we have more than 200 members that logged in virtually this morning, and we're going to be sure to share the link to this event. Just going forward, remaining vigilant, and we've made a lot of gains as a state and a lot of shared sacrifice. What's the most important things that you would be telling us as individuals, as business leaders, for us to be doing, for us to be thinking about in the days, weeks, and months ahead, so that we can do our best and do our part collectively to keep the state healthy and keep us moving forward?
Yeah. Again, I'm going to sound like a broken record between now and December, but watch your staff. Anyone with any potential symptoms, make sure they're not interacting with other folks, whether it's doing the daily testing, taking temperatures coming in, whatever it might be. We still want to encourage people to work from home if they can work from home. I know that can be problematic on both ends. Eventually, I've heard a lot of folks saying, if I don't get out of my house, my wife or my husband's going to kill me, because they want them to go back to work to get to some normalcy. But at the same time, you got to be very cognizant of the public health situation. If you can wear a mask, wear a mask. Why not? It costs nothing. It really doesn't interfere with much out there. Wear your mask. The data is so clear that it works and it helps. If you can stay physically distanced within the workplace or in your communities, please do that. And tell your employees to do it, even outside of the office, because it's so important to keep the rest of your staff healthy and keep your business moving forward. If you don't have the workforce, you ain't going anywhere. And so keeping the responsibility, I think a lot of us have as managers, and keeping that workforce informed and keeping that elevated health and safety message where it really needs to be, both in and outside of the workplace, keeps the economy going forward at a very strong level. And then get tested. There's no reason why you shouldn't. I tell everyone, go get your whole staff tested. Make it a little outing, right? Take them all out to lunch, do a nice outdoor seating at lunch, and then after lunch, you're all going to go get tested. It literally takes a couple minutes at a Rite Aid. You sign up online or at Convenient MD. Go to Convenient MD and sign up, and just and get everyone tested. There's nothing wrong with doing that. And encourage people to do it on a regular basis. Those are the most important things to help keep this viral spread down. We are in a crisis. I know the numbers are low here in Massachusetts, in New Hampshire, and in Massachusetts and in New York, but look at what's happening in other parts of the country. We are not immune from that. That could very easily happen here. It's upon all of us. I cannot magically mandate that the virus doesn't come back here in a strong way. It very well could. So I just want to keep that message very strong, and your help doing that is really, really important to making sure that we're successful in the long run. Our economy stays strong. People want to keep going out, wearing their masks and keeping distancing, but they're going out and spending money. They're going out and interacting with businesses. They're going out and hiring people for services, whatever it might be. As long as the virus stays suppressed, then things are going to keep moving forward in a very, very positive way. We're taking people off of our unemployment rolls about twice as fast as the national average right now. That's a great thing. Let's keep that up, right? And as we get closer to the July 31st and the end of that federal stipend, closer, as we enter into August and even this fall, a lot more people. I think our unemployment numbers will almost be cut in half, frankly, which is a very good thing. But it only works if the virus stays suppressed, and it only works if each of us take that on as a personal responsibility.
Governor, I want to thank you for your time this morning. I really appreciate it. And for all the work that you and the team at the state are doing. The communication has been really appreciated. I know for those of us trying to communicate with our members and with those of in the community, basically knowing that every day at 3:00 I can tune in and see you on TV and get the latest news and hear from Dr. Chan has been really great and helpful to our efforts. So we really appreciate that. And we look forward to hopefully seeing you again soon, and hopefully in person at some point down the road. 2021 state of the state. We'd love to be back in person. So thanks again. Thanks for everybody for coming out today. Want to thank Bellwether Community Credit Union for being our presenting sponsor, Harvard Pilgrim Healthcare, and New England College for being great sponsors and partners. Thank you again, everyone, for your participation. Have a great day. Thanks all.
Thank you, guys. Appreciate it.
Bye-bye.